Hello again, everybody. This is Craig Evans of Autism Hangout, and thank you for tuning into this Autism Hangout special report. Folks, I am so excited about my next guest. Shakespeare said a long time ago that music has charms to soothe a savage breast. And as we know, many of our kids can sometimes use calming techniques. Well, the good news here is music therapy works. And here today to tell us about the philosophies and the techniques of this delightfully successful resource is music therapist Jessica Grooms. Welcome, Jessica. It's nice to have you here.
Thank you. It's great to be here.
Jessica, on your website, you've got many quotes. I happen to use Shakespeare here, but there are many, many quotes out there that talk about the power of music. A couple that were on your site were, "Where words fail, music speaks," and "Music is the medicine of the mind." Now, indeed, two very successful speakers on the spectrum that are out there today on the autism circuit, Donna Williams and Dr. both talk about the power of music in bringing them back to reality. But let's start with this as a primer today. What is music therapy as it relates to our special kids?
Music therapy is an established healthcare profession, and it's a prescribed use of music and music-based activities to facilitate improvement in various areas, whether they be psychological, social, developmental, emotional, physical, more rehab-oriented. Really, music therapy focuses on the whole self, the whole client, and when you assess a client, you're assessing them, the whole self, and treating the whole self. Music is utilized in different ways to meet all of those needs, whether they be communication, socialization, sensory-oriented, and then supporting cognitive skills. Those are kind of the main areas that you think of when you think of autism.
In your practice today, you have many kids coming to you that are on the spectrum. How do you assess what type of music will work for what particular child?
Well, there's several things to look at. One, I do take into consideration during the assessment, usually it's first 2 or 3 sessions just to get a thorough assessment, take into consideration their age. So I may work on, obviously, if I'm working with an adult, I may use certain kinds of music that will be kind of in their environment naturally. And then if I'm working with a child, I may be working more with more upbeat music or music that's more child-oriented. However, you never want that to limit you, because music, there's so many different elements of music that are applicable to people no matter what their age, no matter what their where they live in the world, or what their economic class is, or their social class. So I tell you specifically for autism, music, there are a lot of natural elements of music that we don't necessarily, when we listen to music and when we think of music, we associate it with enjoyment, more kind of right brain things, enjoyment, creativity, relaxation, and something that you do during your free time. But what to look at specifically with autism is the actual structure of music is actually a little bit more of a left brain concept, because it's very mathematical, it's very structured, and provides that a very clear beginning, a clear end, and a clear rhythm that takes you from beginning to end. So those are the elements that I a lot of times will implement when I'm working with a child on the autism spectrum.
So as these kids come in and you go through an assessment period, do you determine at that point in time what type of music will work best based on, say, their sensory issues, or the goals that you choose to set for the session?
The goals really come first, as in any therapy. After you assess, and that's your getting to know you period of time, where you assess needs, characteristics, strengths as well, and interests as they apply to music or certain things that they show interest in that you can pull into therapy and really use to pull them in. But really, the main thing after the assessment is coming up with the goals and the objectives that you want to work on. And then from there, say if I'm working on speech, I may use certain elements of music that lend themselves well to speech fluency, such as more rhythmic based activities. producing physically a rhythm on a drum or on yourself or wherever helps to reinforce the beat physically so that it comes more naturally once you're actually using your articulators and you're trying to use your actual mouth to produce the beat. If I'm working on more sensory relaxation needs, then I would use a completely different kind of music. So it's really all based on goals and objectives, and then from there we cater the music based on what goal we're working on with that client during that activity. Music therapy session really can have anything in it from playing rhythm instruments or drums to parachute and playing a relaxation type of song where the parachute, where they're kind of laying under the parachute and they're looking through the parachute. That creates relaxation. It also creates some visual stimulation where they're looking through the parachute at the light and then the up and down movement, and it gives that auditory input, sensory input as well. So music therapy session has a lot of things going on in it, but it flows and works in a certain way to be beneficial to the client.
What sort of success have you seen?
Oh, I've seen all kinds of successes. And I tell you, I always say, whenever I have a client that comes to me who just seems, how do I put it? Whenever I have an extreme situation with a client, those are the ones that I tell you, you can look back. They may seem challenging at the moment, but the music is such an amazing vehicle for these kids that it's always so rewarding to see the progress that you made, such tremendous progress you made. I think that's the biggest rewarding thing, depending, no matter what the scenario is. So
that's really encouraging. So most of your therapy sessions will last about 3 months?
No, usually after about 3 months, I kind of get together with the parent or the caregiver and we look at progress.
Jessica, how can people find more information out about you?
My web address is jgmusictherapy.com.
Very good.
And my email address is jgmusictherapy@bellsouth.net. I also have a blog at jgmusictherapy.blogspot.com.
Jessica, thanks for coming on today and talking to us about the power of music and music therapy. This is delightfully encouraging news.
Good, you're welcome, thank you.
And Autism Hangout, thanks for tuning in. I'll be back again soon with another special report.